serving, but they're going to be able to serve with this new facility an additional 1,300 people. And that's just an amazing number. When you look around, it doesn't look like there are a lot of homes, but there are a lot of people who use this facility. Now more can come and enjoy the high quality, compassionate care. People that work here, you know, and there are some of you in the audience, and I know, serve here in the Chelan area with the heart of a servant. And that means that you put the needs of others before your own. And I know that's one of the things they do right here for the entire community of Chelan. This has been a community project, a local project, a state project, city project, and a federal partnership. So that's one of the reasons they invited me, because I'm with the federal government and I'm here to help. Thank you.
Thank you, Congressman. Well, we've enjoyed your help for sure, and it was always nice when you would come and visit Chelan and come and stop by the clinic and let us kind of share kind of our stories with you. So it's sorry to hear that you weren't going to run, but thank you for your service. So, as I mentioned, Mike Steele, State Representative Mike Steele, and our chamber president, who's always been a big help when I have questions and concerns and getting this off the ground. So thanks for coming today, Mike.
Thanks, Manuel. Thank you, Congressman. It's a pleasure to be here today. This is one of the best aspects of being director of the Chamber of Commerce, is welcoming new folks into the community. And of course, Columbia Valley Community Health is not new to our community. Learned this morning you guys were started in 1972, and you've been actively working in the community ever since. And of course, the nice thing about Columbia Valley Community Health is that they are partners with us in this community. And all of the folks that are working up here that serve us in the healthcare industry are active in our community as well. And so it's really exciting to be able to open this place up and dedicate a new space to a very deserving group of people who have worked really hard both in the healthcare industry and committed to our community as well. So it's very exciting to do that. I do want to take a moment and recognize my seatmates that are here with us today as well. Senator Brad Hawkins. And Representative Terry Kandata as well. So as the Congressman mentioned, you know, this does take a whole lot of partners to make this thing come to fruition. And it couldn't be done without all of you in the community and all of us at the state level and the federal level, and of course the hardworking team here at CVCH. So I'll turn it back over to Manuel, introduce me a few more folks, and then we'll officially dedicate the place.
Just want to say the chamber office was one of the inspirations for a lot of different design features, but I think the biggest thing was just your commitment to the community and making a room available for community groups. It's just like that was one of the things that we wanted to make sure we had available as well. So thanks for your leadership and guidance, and hopefully we won't cut too much into your business for free office space. Thanks. Our next speaker is the Columbia Valley Community CEO. David Olson joined us kind of when we were halfway through the design project, but has been very supportive and certainly added a few ideas from his experience and helping us continue to make this a great place when we finish. And so thank you, David.
I got this picture running through my mind of people standing up at the Oscars and they know they have 42 seconds and then music starts playing. But we don't have any band, but I'm going to keep it short. All I'm going to do is thank people. So I'm going to thank the very humble Congressman Riker, who didn't mention that we can all think, I can think of exactly 1 million reasons why this was easier to get set up. It's because of our congressman. I'm here in front of a building that's living proof that the government doesn't just take, it also gives. So thank you for that. Thank you to Manuel and his team. CEOs get to just kind of stand up and talk in front of people with pictures. Manuel and the providers, all the staff here, these are really the ones who have made this happen. Because if frankly they weren't providing good care to this community, there would have been no need to do this. So Manuel, thank you and the rest of you. We had contractors, we had vendors, we had people in the community who all helped out, and that's been a big help as well. But now I want to thank the people who really made it happen, and that's our patients and the people who live in this community. I don't think everybody knows that CVCH actually is a community asset. Over 50% of our board members are patients of our various clinics. We don't belong to some big hospital company out of Nashville, Tennessee. We don't belong to a group that's interested in making a buck. We belong to you. So thank you for making sure that we've had the opportunity to grow and to take care of even more of your neighbors. So thank you to the community of Chelan.
Well said. And as David mentioned, one of the joys of working for an organization like Columbia Valley Community Health and Community Health Centers, the reason why I came, because it is a community asset and it's governed by individuals who are part of that community. And I want to introduce Rich Watson, as I mentioned, who is our representative for the board here. And without their vision and support, we wouldn't be able to stand here before the Buick Building today. So thank you, Rich. All right, well, I guess I've been given a pair of very dangerous, large scissors.
Okay, so you know how this sort of works. I'm sure you've seen a ribbon coming for Manuel. Pop over there. Okay. Yeah, close. They are really actually sharp. We're very close to a hospital, I get it, but. All right, so as been said many times today already, we want to thank everybody that came out to dedicate this place. It'll be a very special community asset for years to come.
Hold on, I want you guys here too. Come on.
Anybody that... So,
Letty, Deanna.
all right, staff,
Maria,
come up.
Maria?
Come on, you guys.
Maria.
Come on. Come on up.
We can send you pictures. We can send you pictures.
All right, did we get everybody up here?
All right. On three.
1, 2, 3. Thank you all for coming. Please, if you haven't had a chance to tour the place, come in and do so. Do you have a few more words to wrap up with, Manuel?
I do, and
I messed up my order of presenters, and I do. Now I'm all flustered. So again, as Mike mentioned, this is a partnership, and one of the largest partners that we have here in the organization, in the community, is Lake Chelan Community Hospital. Our providers practice there, our patients go there. They've been very supportive of us and their board in making sure that we have what we need. We're here because they had the vision to establish a plan for the hospital across the street, and that's exciting for us. So I do want to give a chance for our friend Kevin Abel to come up and say a few words as well. And I'm sorry, you're not an add-on. I messed up.
Well, I thought I was going to get out of it, and I was okay with that. And then Dr. Snyder said, wait, I saw you on the agenda. I said, don't say anything. But she did. So here you go. Columbia Valley Community Health has a great history in the Chelan Valley of providing quality medical, dental, and behavioral health services to all the families in our region, regardless of their ability to pay. The new clinic we're dedicating today is more than just a building. It's an extension of Columbia Valley Community Health's commitment to providing to the patients of Chelan, Manson, and Chelan Falls with that quality health care. Columbia Valley Community Health has always been a great partner. Their physicians deliver babies at our hospital. They take care of inpatients, and they're some of the most important members of our hospital medical staff. This building is going to give Columbia Valley Community Health the ability to add providers and grow with our community, creating better access to care and better quality. Building a clinic across the street from the new site of the hospital sends a very strong message about Columbia Valley Community Health's commitment to the partnership with Lake Chelan Community Hospital and the patients we all serve. I look forward to that continued partnership and to having the CVCH clinic and Lake Chelan Community Hospital as a part of the big medical campus up here, providing care for our community. I'd particularly like to thank the Columbia Valley Community Health Board of Directors, including Joan, Christina, Teresa, Rich, Ruth, Joanne, Sean, Lolly, Michael, Robert, and John, as well as the administration for bringing this to our community. So with that, thank you.
Now we'll get a chance to hear from Rich Watson.
Thank you. I guess I am the add-on here. No. First, thank you all for being here, but also I really want to thank Congressman Riker for his support for rural health care over the last few years that he's been in Congress. Without his support, accessing and funding for rural health care, whether it's through hospitals or clinics, it was vital. And I think our congressman really understands that for rural communities to be healthy, vibrant, and sustainable, we need to have quality health care facilities, and I do so much appreciate your support and the work that your staff is doing. And as I look at the building here and I see it's named Columbia Valley Community Health, I really think that it ought to be named Maria, Manuel, Leticia, Jennifer, Carrie. I mean, it really shouldn't be named after them, because in reality, what created this building, even though the board of directors can say we financed it and we funded it and we agreed in the vision of it, but it's really the staff that are here that are passionate about delivering quality health care. They're passionate about reaching out into the community, and they're passionate about making sure that our clients get the best quality health care available. So really, I say to you, thank you for being here, but I really say to the staff, thank you, thank you, thank you, because it's because of you that this facility now exists today. So thank you.
All right. Well, again, that concludes, unless I've forgotten anybody else. No. Yeah. That concludes this today. Again, thanks for coming. Hopefully we'll see you throughout the next couple of years as a patient, or just stop by. This is your resource. Feel free to walk in the trails, ask us for the community room, and come see our providers. We're here for everyone. Thanks again. We're going to get back to work now, and hope you guys enjoy your afternoon. Thank you.